Snapping hip syndrome is actually pretty common. It's common in athletes, especially runners and athletes who typically don't stretch a lot. So normally snapping hip syndrome is when there's a snapping sound in the hip when someone's doing activities like running or various exercises like leg lifts or leg extensions. This is a model of the hip. Snapping hip occurs when the tensor fascia lata or iliotibial band runs along the greater trochanter and rubs around the greater trochanter, or if the iliopsoas muscle, which runs along the hip joint here and it rubs against the hip. So often people will get physical therapy and do a lot of stretches like runner's stretch or iliopsoas stretch or iliotibial band stretch. And the interesting thing is those treatments do help somewhat, but often they're not curative. And the reason they're not curative is because these conditions typically are due to hip instability. Let me again use the model. So this is the iliofemoral ligament, and this is the ischiofemoral ligament, and this is the hip joint. So if the hip joint is moving around too much because of ligament injury, then the hip joint is going to rub on the iliotibial band or the iliopsoas muscles. So the best treatment, I think, for snapping hip syndrome is actually prolotherapy, because prolotherapy gets at the root cause of the problem, which is hip instability. The muscles tighten, the iliopsoas muscle tightens, or the tensor fascia lata, which goes into the iliotibial band, those tighten because they're trying to stabilize the hip. So by doing prolotherapy into the hip ligaments, and sometimes you actually also have to treat the labrum because the hip labrum also is involved with stability of the hip. So if you treat those structures, the hip stabilizes and thus the muscles relax and you get resolution of the pain and the snapping sound of snapping hip syndrome. And I'm going to show an illustration that we made that shows that, and you'll notice on the illustration that it's actually the labral tear. For the illustration purposes we use a labral tear, but it could be a ligament tear. A labral tear, often what the person will feel is a clicking sound or a crunching sound or a snapping sound in the hip, especially when the hip is externally rotated. So if somebody feels their hip where it hurts in the front and they feel like a grindy sound or a clicky sound, or if they hear it, that means the hip joint's unstable. And the treatment for an unstable hip is basically prolotherapy. Usually it's about 3 to 4 or 5 visits of prolotherapy, and we normally see people about once a month. So definitely if somebody has a labral tear, hip instability, and thus causing snapping hip syndrome, the treatment should be prolotherapy.